Around the world, water supplies are under increasing pressure. As populations grow and cities expand, fresh water sources are depleted or contaminated, and climate change impacts weather and rainfall patterns. In Zimbabwe's capital city of Harare, clean water availability and quality has steadily decreased over the years, and the country is expected to suffer water stress by 2025. Communities mostly rely on boreholes for water, but constant bacterial contamination has caused regular outbreaks of waterborne diseases like typhoid and cholera, leaving thousands ill and at risk of dying.
Munharaunda muno mukare vanhu vaichera mvura mumugodhi nepamwe panenge pasina kuvharwa, saka zvaiita kuti vanwe mvura isina kuchena. Vanhu vaitombofa nezvirwere zvekorera natyphoid nokuda kwokuti vainwa mvura isina kuchena.
To mitigate the water scarcity and recurrent diarrheal outbreaks, MSF Environmental Health Project has started diagnosing the existing boreholes with the main focus on providing clean water to the beneficiaries, but also to understand what are the underlying causes of bacteriological contamination in borehole water. MSF also conducted geophysical surveys to increase the quantity of water. Some of the boreholes are providing about 30,000 liters of water per hour, where the average borehole yield in Harare is merely 2,000 liters per hour.
For people living near dysfunctional or damaged boreholes, getting clean, potable water means organizing their schedules and lives around reaching other water sources. Water collection would often mean poor families have to walk far distances, pay money to access water points on a daily basis, or wake as early as 2 a.m. each day to collect water.
Asi nokuda pakazoya project semhuri yangu ndakabenefita pamvura, taakunwa mvura yakachena. Kumba kwakugara kwakachena nokuti tinechiwana mvura. Nharaunda yedu zvakuratidza kuti pose kana mukafamba mukatarisa vanhu vakunwa mvura yakachena. Uyezve zvakaita kuti zvirwere zvemanyoka zviderere mukati memusha wangu. Then vana vakunwa mvura yakachena.
The challenge of ensuring Harare's residents have access to clean water cannot only be solved by finding new water sources or rehabilitating boreholes. In the suburb of Stone Ridge, the MSF team and community partners run a pilot project aimed at reducing the risk of contaminated wastewater, which had previously been stored in septic tanks. These tanks were prone to leaks, contaminating the groundwater in the area and contributing to recurrent diarrheal outbreaks.
The area was poorly sanitated. Those old septic tanks built in such a way that they were shallow, and if the water table rises, the whole underground water will be contaminated.
In order to mitigate the risk of Stone Ridge's water table becoming contaminated by these underground septic tanks, MSF replaced them with a new wastewater management system.
Here I'm standing at the communal waste treatment unit, which then treats all the wastewater that is coming from the household, and then the water is recycled to be used again in the toilet and for irrigation of the gardens.
We are enjoying a good environment, good flora and fauna, good agriculture output. So when this project started, new decongesters were connected to this treatment center. So we now have all our waste being piped. So there's no contamination around the contamination of the water. We are so proud and humbled to have such a good system.